There's a very important and useful healthcare initiative the Palm Beach Civic Association's Healthcare Committee has put together, and for future problems down the road, including our current crisis. Wendy Rutledge reports on that.
Tim, sometime in the next week or so, current members of the Palm Beach Civic Association will receive these items in the mail. These are a small and large version of a personal medical form that you're going to be able to fill out, and two-size pouches in which you can place these forms. Now, this is all part of a brand new program that was started by the Healthcare Committee for the Palm Beach Civic Association, specifically led by Chairman Jeff Levitt. And the idea really came to the group from one of its members, Lynn Foster. So please take a listen to these interviews with both of those people as they explain to us the importance of these forms, why they're going to be important to you and your health, and why you should fill them out, and specifically why it's going to be very good for our entire community.
Jeff, what does the Healthcare Committee of the Palm Beach Civic Association do, and what is its purpose?
Wendy, we're a committee of about 20 Palm Beach Civic Association directors and members who meet throughout the year to discuss ways in which we can best address the healthcare needs of all Palm Beach residents. The purpose of the committee was to help Palm Beach residents lead healthier and happier lives. So we end up gathering relevant healthcare information and communicate and educate our community as to the ways in which we can improve the quality of their lives.
What was the healthcare problem that the Lifeline Project was addressing, and how did it come to the attention of the Healthcare Committee?
Well, we're very fortunate in that our chiefs, both Donato and Baker, regularly attend the Healthcare Committee meetings, and they let us know that often they didn't have critical medical information about the patient when their EMTs were called in to help residents. And this was because there's electronic medical records everywhere, but they're unable to access that information because it was either at the hospital or the doctor's office or in the record somewhere, but it wasn't available to the EMTs.
Why is the Lifeline solution so important to the Palm Beach Fire Rescue and to the hospital that will be treating a transported patient?
If Fire Rescue had that information in advance when they first see the patient, they could start appropriate medical care immediately on the way to the hospital, and they'd also communicate that information ahead to the hospital while they're en route, so the hospital staff would be ready to receive the patient and jumpstart the care that was required.
And that sounds so important. So what are the benefits to the resident by providing this information?
Well, if our EMTs and hospital personnel are made aware of pertinent medical information in advance about the patient, particularly the current medical conditions or the patient's history and current medications, they'll be in a position to accelerate their care and treatment and probably save time and lives by having access to this information.
Prior medical conditions such as, say, COPD or asthma are going to be truly important if they're making rescues of people with potentially infectious COVID-19. So maybe this is incredibly timely.
Yes, of course, especially now where all healthcare community personnel are under incredible stress and pressure. So being able to have that medical history, including information about cardiac conditions or orthopedic things that are going on with the patient, are very, very important. So yeah, the timing couldn't be better. We're extremely grateful to have Palm Beach Fire Rescue, the chiefs, their staffs, and also I really want to commend our member, Lynn Foster, for learning about this problem and creating a very simple solution to solve it. I think that by having this information available to caregivers is critically important, as is evident from times like we're all going through. So thank you to all of them, and thank you very much, Wendy, for the time today.
Several months ago, you brought in a homemade version that you have been using for years. It was really quite charming, and I believe it involved duct tape. But can you describe your own version of what you made maybe many years ago?
Yes, I'd be happy to. Basically, this project began early this season when Jeff Levitt, chairman of the Healthcare Committee, gathered us all together for a review of what we had accomplished during the past season and to brainstorm about ideas for the coming year. And as you pointed out, during that meeting, I passed around this card-sized piece of paper that I had laminated with my tape gun and created for myself several years ago. And it contains my pertinent medical information, which I update annually. The reason for doing this was for me to have at my fingertips the information that most physicians request of a first-time patient. My card contains such information as the names of my doctors, my insurance, my vaccines, surgical and major illness history, prescription medicines, and emergency contacts. I keep copies of this form with me at all times and have one inside the door of my house and one in my car. It gives me the confidence that should I be in an emergency where I might be frightened, in pain, disoriented, or unconscious, and unable to respond coherently, that this information is readily available to our first responders, giving them this important medical information immediately that may prove critical in an emergency. So during this meeting, when this piece of paper was circulated, Fire Chief and Director of Emergency Management, Dale Donato, and Sean Baker, who's the Fire Rescue Division Chief, both were extremely enthusiastic about this and said that everyone in Palm Beach should do this. So on that endorsement, we launched what we've called this Lifeline project. And it's a very small team of healthcare experts, including Jeff Levitt, who has a lifetime of experience running healthcare service businesses. Maggie Zeidman, our incredible town council member and former head of nursing services at Lenox Hill in New York. Judy Goodman, who's an attorney specializing in healthcare strategy and research, and Daryl Donato and Sean Baker. And together we vetted the contents that should appear on this form and prepared to launch it at our annual meeting. I also, during the time, talked with some of our community leaders such as Paul Leone, CEO of the Breakers, who's very enthusiastic about sharing this form with his 2,200 employees. Well, shortly thereafter, COVID-19 intervened and the urgency of this launch intensified. So we'll be sending to Palm Beach Civic Association members blank forms and plastic sleeves for the completed forms. And we encourage everyone to complete the form and keep one in their wallet or purse, one near their prescription medicines, and a copy in their car. It's an entirely voluntary effort, and any information on the form is purely at a person's own discretion. But we hope that everyone will follow the advice of our first responders and keep this completed form with them at all times. You know, last night we lit up the night in honor of our extraordinary healthcare professionals. And this information will provide them with an additional tool to enhance their ability to deliver even more efficient healthcare to our community during these critical times. So that's sort of a summary of what we're doing, Wendy.
Such a terrific project. What's your vision right now? Members of the Civic Association will receive this. Do you see it going broader at some point?
Absolutely. In the fall, our hope is that we will then be in a position, we'll get feedback from our community of Palm Beach Civic Association members, and we'll tweak the form. And then we will reach out, which I've already started to do, to various members in the community, like the business leaders, the religious leaders, and see what their appetite is for this so we can get a sense of how they would like to incorporate this into what they do, and then work with them to do a broader launch in the fall.
That sounds great. Lynn, thank you so much for your time and for putting this project together.
Well, thank you. It's very exciting and important.